Hi everyone, this is Dr. Luke here from In Motion, and I'm going to talk to you today about a condition that's really tricky that we see in the clinic all the time, and that's either golfer's or tennis elbow. So both of those conditions are conditions of the attachments at the elbow being irritated for the muscles that are in the forearm. Okay, so a tennis elbow is pain on the outside of the elbow right at the attachment, and that's the attachment for all of the extensor muscles on the outside of the arm here. Golfer's elbow is the same condition on the flexor attachments here on the inside of the elbow. Now I'm dealing with the golfer's elbow right now, and so in the clinic we have a number of modalities that are very useful for managing this condition. So we've had a lot of success with our shockwave machine, as well as dry needling at those attachment sites. In this condition, the problem a lot of the time is the fact that those tendons, where they attach into the bone, there's a lot of tension there, and they have trouble because they have a low blood supply. There's a difficulty in healing, and so they get stuck in a little bit of a cycle where, in truth, they end up almost weakening over time. So what we want to do is we want to kickstart that healing cycle. So something you can do at home, and we assign to our patients a lot of the time, is a cross-friction technique. So if I have tennis elbow, I'm going to take the attachment site up here at the elbow, the sorest spot I can find, and I'm going to come just off of that sorest spot. I'm going to compress. And then knowing that the muscles are running in this direction, I want to go across that direction. So I'm going to get the sorest spot here and I'm going to rub back and forth, hard as I can. Should almost bring tears to your eyes, rubbing back and forth for 30 seconds. In the case of my golfer's elbow, the attachment's on the inside here. I'm going to take, again, sorest spot I can find. It's a little bit nasty. And I'm going to come back and forth across that attachment using my thumb. I'm going to spend 30 seconds hurting that spot. What we're trying to do here is I'm trying to break down that sort of weakened tissue and kickstart the healing cycle again, okay? So cross frictions daily for 30 seconds. The other thing we want to do is stretch. That's really important. So for the flexor muscles, we want to be palm pulled back, elbow fully straightened and at shoulder height. I'm going to hold for a minute. And I'm also going to stretch the other side for the extensor muscles. I'm going to do a light fist. I'm going to pull my wrist down, again, shoulder height, elbow straight, holding 60 seconds. A couple of at-home ideas for these really tricky conditions as we get out into the spring and hopefully get back to golfing and tennis. You may run into these conditions. Come and see us at In Motion if it doesn't go away with the stretches and the friction. We'll talk to you soon. Thanks.